Today we will be diving into the fascinating world of eosinophilic gastroenteritis, e.g. This comprehensive overview will cover topics such as the pathogenesis of e.g., immunological mechanisms and hypersensitivity reactions involved, clinical presentations and diagnostic approaches, endoscopic findings and histopathological features, differential diagnosis, treatment strategies and guidelines, the role of dietary modifications in e.g. management, systemic manifestations and extraintestinal involvement, complications and long-term sequelae, predominant eosinophilic infiltration sites, and prognosis and predictors of disease course. So let's get started. Eosinophilic gastroenteritis is a rare gastrointestinal disorder characterized by eosinophilic inflammation in one or more layers of the gastrointestinal tract. The incidence and prevalence of EG remain unclear due to its rarity and the lack of consensus in diagnostic criteria. However, it predominantly affects children and young adults with a slight male predominance. The exact pathogenesis of EG is still not fully understood. However, several hypotheses have been proposed, including allergic reactions, immune dysregulation, genetic predisposition, and environmental factors. It is believed that the release of eosinophilic granule proteins and subsequent activation of local inflammatory mediators play a significant role in tissue damage and symptoms. EG is considered to be a T helper 2, Th2, cell-mediated hypersensitivity reaction. Immunoglobulin E, IgA, plays a crucial role in the pathogenesis, with elevated serum IgA levels observed in some patients. Various cytokines, chemokines, and eosinophil-attracting factors contribute to the recruitment and activation of eosinophils in the gastrointestinal tract. The clinical presentation of EG can vary significantly depending on the affected gastrointestinal segment. Common symptoms include abdominal pain, diarrhea, nausea, vomiting, weight loss, and malabsorption. Diagnostic evaluation includes a thorough medical history, physical examination, laboratory tests, imaging studies, and endoscopic procedures. Tissue biopsy with histopathological analysis remains the gold standard for definitive diagnosis. Endoscopic findings in EG can range from normal mucosa to erosions, ulcers, nodularity, or strictures. The affected segment shows edema, erythema, friability, and sometimes a cobblestone appearance. Histopathological examination demonstrates eosinophilic infiltration in the lamina propria, epithelial layer, and even the muscularis propria. Other characteristic findings include cryptitis, crypt abscesses, and fibrosis. EG should be differentiated from other conditions that can cause eosinophilic infiltration in the gastrointestinal tract, such as parasitic infections, inflammatory bowel disease, celiac disease, drug reactions, and malignancies. A systematic approach based on clinical presentation, endoscopic findings, histopathology, and response to therapy aids in establishing an accurate diagnosis. The management of EG is challenging due to its rarity and heterogeneity. Treatment options include dietary modifications, pharmacological therapy, and, in severe cases, immunosuppressive agents. A multidisciplinary approach involving gastroenterologists, allergists, dietitians, and psychologists is often necessary to provide optimal care to patients with EG. Dietary modifications play a crucial role in the management of EG. Food allergens, such as cow's milk, soy, wheat, and eggs, are commonly associated with EG, and their elimination from the diet can lead to symptomatic improvement. Elemental or amino acid-based formulas may be considered in patients with severe symptoms or multiple food allergies. EG is not limited to the gastrointestinal tract, it can involve various other organ systems. Common extraintestinal manifestations include peripheral eosinophilia, skin rash, asthma, allergic rhinitis, eosinophilic pneumonia, and eosinophilic vasculitis. These systemic manifestations may precede or coexist with gastrointestinal symptoms. If left untreated, EG can lead to complications such as intestinal strictures, fibrosis, and perforation. Long-term sequelae may include malnutrition, growth retardation in children, iron deficiency anemia, and osteoporosis. Regular follow-up and appropriate management are necessary to minimize these potential complications. EG can affect any part of the gastrointestinal tract, but certain regions are more commonly involved. The stomach and small intestine are frequently affected, followed by the colon, esophagus, and duodenum. The pattern of eosinophilic infiltration and severity can vary among different segments, contributing to the diverse clinical presentations observed in EG. The prognosis of EG is highly variable, ranging from self-limited disease to chronic or relapsing conditions requiring long-term management. Several factors, including the age of onset, eosinophil count, extent of involvement, and response to therapy, have been identified as potential predictors of disease course. Further research is needed to refine prognosis estimation and identify effective therapeutic strategies. In conclusion, eosinophilic gastroenteritis is a complex and intriguing gastrointestinal disorder that involves eosinophilic inflammation in one or more layers of the gastrointestinal tract. Understanding the pathogenesis, diagnostic approaches, treatment strategies, and potential complications associated with EG are essential for providing optimal care to affected individuals. Further research and collaboration among gastroenterologists, allergists, and other specialists are warranted to improve our knowledge and management of this rare disease.